Welcome. I'm Julie Thompson, Executive Director of PAC-TV, and today we're hosting a COVID-19 regional forum on mental health amid the pandemic. This virtual panel forum was organized by Representative LaNatra, who will introduce you to the experts she has secured for today's special. To watch this forum live in Kingston, Plymouth, Pembroke, and Duxbury, visit Comcast Channel 13 or Verizon 43, or watch online on our streaming channel by visiting pactv.org/live. To ask questions during the forum, please email them to questions@pactv.org. To replay this forum, simply visit pactv.org/regional. Welcome, Kathy.
Hi, Julie. Thanks for having us. Very excited to be here again. This is our third in a series of 4, but now it looks like it's going to be a series of 6, which is wonderful. So many topics for us to discuss. Today, I'm so fortunate to have 3 wonderful guests. We are going to talk about grief today. We have Denise Brack, who is the co-founder and director of Hope Floats. We have Vedna Heywood, who is a trauma nurse in Boston. And we have Maureen Walsh, who is a psychiatric nurse practitioner. So we're going to discuss, they're going to say a few words about what they do, about what they're seeing here during the COVID pandemic, and then we're going to open it up for some questions. So I'd like to start with Denise Brack. Denise is the co-founder and director of Hope Floats Healing and Wellness Ctr, and that's located here in Kingston. After the devastating loss of her son, Michael, she and her husband, Ken, founded the nonprofit Bereavement and Educational Center, serving the South Shore and Southeastern Massachusetts. Welcome, Denise. Thanks for joining us today.
Thank you. Thank you for having me. It's a pleasure to be here to be able to talk a little bit about what we do at Hope Floats and how we support people who are grieving. We offer free support services to adults, children, teens, and their families. And my husband and I really wanted to start the center after the death of our son to support people who are dealing with loss, dealing with grief and illness and other things that are life challenging. So we offer a variety of services at Hope Floats, but today I'm just going to focus on our bereavement programs. So in a perfect world, before this pandemic, we would be seeing people in person at our beautiful location in Kingston. And we currently have 12 support groups. So these groups are run by trained volunteers who are peers. And we have groups such as several groups for child loss support for parents. That includes a group specifically for overdose and substance abuse loss. We have an ongoing suicide loss group just for dads. And we recently started an LGBTQ partner spouse group this spring. And that's just a few of the groups that we offer. We offer many more. Mike's Club is our group for children, teens, and their families. And this is one of our fastest growing programs at Hope Floats. And this is for children who have lost a parent, caregiver, or a sibling. So the group runs through the school year, and this year we offered 3 nights of Mike's Club. And it's really a needed program because this year we offered up to, we've serviced actually 60 children for this program. So it's really an important program, and we're really proud of how this has grown and developed over the years. Another important program I wanted to share with you is our day-long support retreats. These are what I like to call self-care days, and they are for adults. We typically have them for adults who are dealing with bereavement. We also offer it for cancer support and caregivers, but they're day-long restorative days where people come. We incorporate a support group as well as integrating some holistic treatments and yoga and meditation. So people come to this and they walk away feeling very rested and cared for. So this is a program that's very important to us. We offer these every couple of months, and we can see this becoming something that we do a lot of things around this pandemic with. We are also fortunate at Hope Floats to have very dedicated independent counselors. We have 7 of them who are housed at the center, and they meet with individuals through insurance. So we're very blessed to have them. So, due to this pandemic, we have been working diligently to adapt to new ways to stay connected to our community. Um, we're now doing all of our support groups on a virtual platform because we know how important it is for people in grief to stay connected. And when you're grieving, you're feeling isolated even on a good day. So you add physical isolation to this, and it just exasperates the situation for these people. So it is vital for us to keep them connected, and we are trying very hard to do that through virtual groups. I'm very uh, grateful for technology. Running groups this way is not ideal, but it's all that we have right now. So we're really grateful to be able to offer this. We're doing similar things with our Mike's Club families. These families are going through so much stress, and we want to continue to support them. So we've been doing some virtual groups, and also we have some talented volunteers and staff who have created videos. So some people are reading books to the children, or they're doing activities with them that we email out, and parents can just open up when they want to work on those things. So it's been a great way to stay connected, and these parents need our support. So we'll be there for them for the long run. So to wrap this up, I have a couple of new offerings that I wanted to share. First, we are having a new group for healthcare providers who have cared or are currently caring for for patients who are dealing with COVID and their families. And Vedna's here today. She'll be speaking more to that. She'll be co-facilitating that group. And then we also have a support group for families who have lost a family member to COVID-19, if it was a parent, spouse, or child, to this pandemic. So we know there are many layers of trauma for these folks. Just think about them losing someone and not being able to say goodbye is horrific. So we wanted to create a support group where they could be with others who've had similar experiences. And then when we are fortunate enough to open up again and we can meet in person again, we will be running those day-long retreats for frontline healthcare and essential workers. So we're really looking forward to the day that we can do those retreats again. So I'm happy and glad I could be sharing some of what we do at Hope Float. So thank you for having me.
Oh, I'm so happy. Such important work you're doing. Actually, it was bringing me a little to tears. You're doing a lot there.
Thank you.
And I know that Vedna is going to speak to that. So Vedna Heywood is a volunteer, co-facilitator of a lost group at Hope Floats, like you said, Healing and Wellness Center. She's been affiliated with the organization since 2013 and started co-facilitating a pregnancy, infant, and toddler lost group in 2015. She has a certification in thanatology. Did I say that correctly? In thanatology, that's the study of bereavement, and training as a bereavement specialist through the Mass Center of Unexpected Infant and Child Death out of Boston Medical Center, where she did personal home visits with families experiencing loss. Vedna is an RN currently working at Brigham Women in Health, has over 20 years of experience in critical care, particularly in the areas of surgical, intensive care, and trauma. After experiencing an infant loss over 10 years ago, she was drawn to this work. Vedna, I'm so happy that you're able to join us today. Thank you for coming.
Thank you for having me, Kathy. Thank you for this opportunity to speak on this topic. As Denise has mentioned, so I guess for me, being in the this field and seeing some of the loss that's associated with COVID, it has been it's been interesting. Considering the 20 year span. So when I started nursing, I started at the end of the HIV epidemic. So initially, as a very young nurse, seeing seeing the results of people going through that loss. HIV was still very much a communicable disease. And so now, as I'm heading towards the end of my nursing career, to see this this pandemic come up and see the loss associated with it. For what I've some of the things I have seen are obviously, as we mentioned, the isolation of having a family member in a hospital setting, not being able to visit them, and then unfortunately losing that family member, not being part of their like day-to-day care. We do make phone calls, but that's never the same as being at your family member's bedside, and so it becomes like a disenfranchised loss. For the coworker, for my coworkers, it's being part of that process, and knowing what is your normal routine, um, uh, and having that kind of shattered and going like blindly into this. Into the pandemic, and I think that's for a lot of organizations. So it's for me, it's they're they're like the moral distress attached to this, compassion fatigue attached to this, your norms in terms of how you do your nursing, um, and that's kind of thrown to the wayside. You always have your basic foundation, but in in a crisis, it's somewhat different. And then also the deaths associated with it. We have deaths. So working in trauma, deaths come, but not to the extent to which we're seeing them. So this back to back to back and not having a reprieve is difficult to kind of digest. And I think as healthcare workers, uh, sometimes there is that inability, just because we stay in caretaker mode, to process some of that. And so here, thankfully, and hopefully, with this support group that we have coming up in the next couple of weeks, this gives a space for the healthcare workers, just to kind of be heard, um, to identify like some of those uh, the anxieties that we have going through this work, to identify some of the fears, to empower each other through this. I think sometimes, like even that, like recognizing that is difficult. We kind of hold on to, okay, I need to be here for them, and if I go outside of that, I'm going to break,
Mm.
and I can't do that. So, allowing that space to kind of open up and say, this is how I feel. These are my fears. Um, and maybe having some sort of protection against any secondary traumas that may occur from, being part of this on a day to day.
It's great that, so in a way it's the healthcare workers are grieving together.
Yeah.
So that's what it sounds like in that, when you're with someone, I find, that's been through the same situation, you can't bring that home to your families. I'm married to a first responder, and a lot of things, he was actually in 9/11, he worked in New York City then too, and that's something that
Wow.
it really helped him to have people around him that dealt with the same situation, because it's something that I wouldn't understand, or someone that wasn't there that wouldn't understand. So that's wonderful. That I'm sure will be extremely helpful.
Yeah.
Extremely. Thank you for that.
Yeah.
I would like to introduce Maureen Walsh. Maureen and I have been emailing back and forth. So this is the first time we've actually met face to face. It's wonderful to meet you finally face to face.
Likewise.
So Maureen Walsh is a psychiatric nurse practitioner, grief therapist, and educator. Maureen is certified as a fellow in thanatology by the Association for Deaf Education and Counseling. While working as a school nurse, health teacher, Maureen started the school bereavement program and coordinated it for 14 years. She developed Lessons for Life and Loss, a grade 1 through 8 school bereavement program, which she has presented to facilities of various schools, faculties of various schools, I apologize, on the South Shore. Maureen began her own grief practice, Grief Weavers LLC, in 2007. in which she sees private patients and speaks at schools and community organizations about grief issues. In 2017, Maureen moved grief weavers to Hope Floats Healing and Wellness Ctr, where she continues her private practice as well as facilitates the sibling loss support group, assists in Mike's Club, and is part of the HEIART program, Hope Floats Education and Awareness Response Team. Thank you, Maureen, for joining us here today.
You're welcome. Good to see you, Kathy.
Good to see you.
So you asked me to talk a little about my practice and what I'm doing now during COVID. And so basically I'm seeing everyone virtually. I have several patients that can't do it for internet connection or just not comfortable. So I talk to them on the phone. But generally I just see everyone on a platform like Zoom. It's a HIPAA platform and that's working out okay. I'm like Denise, this isn't my thing. I would much rather be doing it in person, but I am so grateful that I can connect with my patients this way. What I'm seeing in my patients, and it's all I have is grief, all my patients are grief and grieving, is increase in anxiety, increase in depression, increase in PTSD, because there's so much going on with COVID that they have already seen. They've lost loved ones. I have parents that didn't get to see their children's bodies before they were buried. I have that didn't get to say goodbye. You know, I have patients that had loved ones on ventilators that had to be taken off when they died. And all the talk about ventilators, not so much now, but several weeks ago, was very, very triggering for several patients, you know. So, and then that's just the general grief of because they've already grieved. And every time you lose a loved one, you re-grieve when there's another loss. But then COVID has caused loss for all of us. I mean, our very routines are gone. The way we connect with people, the ability to hug people, the ability to run across the street to your neighbor, all that has changed. For kids, it's really big. I see a lot of kids and they're having a hard time. They're not even in school anymore. And school on the internet is not the same. Again, we're grateful we have it, but it's not the same. So there is this huge, huge basket of grief that we are all carrying. And that's what we need to work with people to understand where they are, to go where they are and start there. And with my folks, just being able to vent, I think is very, very important, to listen. And then to come up with some strategies to get through this, because we will get through this. This is going to end. I don't know when, but it will end. Things will get back to a different normal. I don't know if we'll ever go back to where we were because we'll be different people then. So I've been trying to work with people and explain to them what can you control. So COVID has wiped out so much of our control, but it hasn't taken everything. All right. And we can control our feelings. We can control how we react to COVID. We can control so much of what's going on in our lives. And it's just a matter of putting on a different pair of glasses and looking at it. And so that's what I've been working with my patients.
Well, I like that analogy, put on a different pair of glasses in the way you look at it. I need to remind myself of that some days. I find that just through my family and my friends, that it is a roller coaster. One day you will get up and feel a little hopeless that it's never going to end. And then the next day you feel a little better. And it's just like this. But I find that, but how would you know that the stress of COVID, when you're with in your family unit and you see people changing, what are some of the signs that you should really reach out to a doctor or a health professional?
So absolutely, this is so important. And I go over this with each of my patients all the time. So the things you want to look for is sadness is okay. Any feeling is okay, but when it gets depressing. So when you get people that are withdrawing from life, they don't want to take a shower any day. They don't, and a lot of people aren't showering as much as they used to because of COVID. But when you get someone that's not brushing their teeth, they're not showering, they're not eating, they really don't care. Right? If they may be talking about this is the end, they may be talking about they're overwhelmed, or the other way is they're not talking at all. Right? These are the people that I would be, I'd say, okay, let's contact somebody. And there are resources available. You can talk. And certainly if anyone mentions suicide, and you always take a suicide talk seriously. You never brush it off. You never just say, oh, this is just, we're all feeling down. You always have a professional evaluate somebody. So certainly that is a 911 call if you feel that you can't get a hold of someone over the phone right away. But those are the signs that I would be very concerned about, that I am concerned about when I hear about. This is too much. I just can't handle this. I'm going out of my mind. I don't know what to do anymore. Okay, that's when I get worried.
Okay, good advice. Julie, I understand you have a couple questions that were called in.
Yes, a couple, and I'm not sure if who'd like to take it first, maybe Vedna or Maureen. It's about the first responders. And so we all see, sometimes on the news, they'll interview a nurse or a doc that has been with these patients that are suffering, that are on the ventilators. And it clearly is just a massive impact on them, without a doubt. So couple that with having to struggle with let's all return and go out into the world and not wear masks. And that must add just another insult to injury for them. Can you speak to that, how that also causes trauma to our first responders? Vedna, want to start with you? You're muted, Vedna. You just need to unmute yourself. That's okay.
Sorry.
Go ahead.
There you go.
I think sometimes for us, so, seeing a patient on a ventilator, having to deal with the struggle in terms of what's it called? Work restrictions, the change of routine. Are we the minimizing like resources and to know that there are ways to kind of slow this down or kind of like mitigate the amount of people that arrive in a hospital setting, and for people to attempt to go and not actually follow those directives. It's a struggle for us to see that, because we know what this looks like inside of the hospital. We know, and it's hard. I think it's hard in both ways. In terms of a community, for the most part, most people don't see what a first responder sees. So they're gathering their information from the news, or what they're seeing on television, and it's so conflicting. It's so conflicting. But we need to kind of validate, the experience that these first responders are having, and know that we are here to not only support our communities, but to support those patients in a hospital setting. Yes, sometimes it feels like it is a slap in the face. But for us, it's because we see the end result of this, we're attempting to protect the community. So what our government officials are asking of their communities, it's an attempt to protect the community. So it's difficult to see, it's difficult to hear. I understand we want to exercise our rights, and this is what this country is, based on. But this is a public health concern. People are dying.
Right.
People
Absolutely.
are dying.
Yes. That was a great answer. Maureen, did you want to add to that at all?
Well, I think, anyone in the healthcare field, first responders, respiratory therapists, nurses, doctors, counselors, therapists, anyone. And if I've left anyone out, please know that I don't mean to. I think we all have a box that we put our emotions in when we're dealing with our patients, because we can't, it's not going to help a patient, though I'm Irish, so I cry easy because my kidneys are here and not in my back like other people. And when you're sitting with a mother who has just buried a child, it's not going to help her if I lose it completely. I will tear up often. I will hold her hand and hug her, but I can't lose it. That's not my role for her. I'm not going to help her. And nurses, when I worked in the hospital and wherever I've worked, it's the same way. You put your big girl pants on, so to speak. Right? That's what first responders and medical people do. So what's important is that we remember to open that box afterwards. And we need to open that box and let those emotions out. and acknowledge them and acknowledge our own fears and our own sadness. And wow, I just sat with a woman who buried her daughter. You have to let that out. And that's what happens with first responders is in an epidemic like this, a pandemic like this, there isn't time to open that box. And that's why what Vedna is going to be doing with the support group and what we're going to do at Hope Floats with the day-long retreats is so important. We've got to open that box. We've got to acknowledge all those feelings and all the confusions and how we have experienced them, and then share that. We have to share our stories.
Yeah, that is wonderful. And you're talking about the Healing for Helpers program that you're going to be running at Hope Floats. Vedna, I know you're going to be running that. And after just listening to you two, it's like your mind goes into a million places. Like, you guys have to do all this, and then you have your own families and you have your own situations to go home to. So it's almost like double duty, and it's just so appreciated. Kathy, I'll bring it back to you.
Thank you, Julie. On that note, how do you deal? You've dealt with all this, and now you're going home to your family, and now we know our children they're not in school, they've been home. How do you deal with that? In when you're, like you said, everything's in the box, and you need to let everything out of the box, but you're not able to do that when you go home.
Who do you want to answer?
Oh, whoever wants to answer. Maureen, if you want to go. How do you help your kids? So you're helping all your patients and their families, and now you need to go home and you have to help your children deal with COVID, the stress of COVID. And it feels like it would just keep piling up.
So, well, my kids, unfortunately, are all grown up and live away. My son is in California. My daughter is in New York City. She is a doctor at Presbyterian Hospital on the front lines with COVID. So that is a stress. I'm incredibly proud of her, as I am so proud of my son. So I don't have little kids to deal with like Vedna does. So that's a little bit easier. I also have the most amazing, understanding husband in the world. But there are things that I do, and I do them deliberately. So I love to cook. So for me to come home from a day after work and make supper is very therapeutic for me. Phil loves to do the dishes, so that works out great. I like to read. I love to get out in my garden and in the winter in my plants in the house. I have things that I do that I have to do. My faith is very important, so do a little praying there every day makes a big difference for me. And finding joy in things. I like to find joy in the littlest of things because that gives me the strength to go on. So I know how if I can't fill my own soul, I can't be of help to anyone else. So I have to nourish my own soul, and it's not selfish. And it took me a long time to figure that out, but it is true. So that's what I do to get through it.
Wow.
I also want to add to that.
Good.
I want to add to that.
Yeah. I can hear you, Denise.
Okay. I think it's been interesting because I'm also, dealing with a lot of clients and still getting people into groups and things like that. But what I found is that I'll use being on the mountain, when we're on the mountain, life is good, right? And when we're in the valley, dark things have happened. We've had a loss, something has happened. Everyone is in the valley right now. Mm-hmm. And I think that we need to be kind and patient to one another. So whether you're, no one has the wisdom of experience that we can say, oh, I've been through this and I know how to help you with this. So we're all trying to learn how to do this the best we can. So I think it's important for people to realize that folks that are first responders or counselors, whoever, healthcare providers, we're all in the same place trying to figure this out. So I just wanted to add that too as well.
Thank you, Denise. I think Julie has another question for you as well.
I do. Yes, Denise. Everything you do at Hope Floats is just amazing. I know we've been familiar with your organization for quite a while here at PAC-TV, and we've done some stories about you and what you do and what everybody does there. A huge part of everything you've always done is the whole physical, being able to hug and to hold and to cry in each other's arms. How much of that not being available is affecting everyone's ability to let it out, and your ability? It must drive you crazy that you can only give virtual hugs at this point. Can you speak to that? Because a lot of people have brought that up.
It does. I mean, that our whole everything that we do at Hope Floats is in person. There's a lot of hugging going on during support groups. People come in, we give them hugs, they leave, and I know that people are really hurting because they can't be together right now, and it's this has been grief for me not to be able to bring folks together. I don't know how we're going to get through this, for long term doing these things through virtual platforms. I hope we don't have to. I hope this, like Maureen said, this will end. I hope it's sooner rather than later that we can get together, because everything that we do is about being together. People who are grieving want to be with other folks, want that connection, and that's really missing. This is helpful, but it's not the same thing.
Right.
Yeah.
I have another question. And you're right. You can't replace the in-person. I mean, this is wonderful that we can all communicate through Zoom in this way and through our phones. It's great, but it's not the same, and it'll never be the same. The thing about it not being forever, how much does that play into all of you being able to counsel people to try to, instead of looking all the way down the road and saying this is never going to end, to give little moments of hope and little moments of inspiration that slowly things will happen. And every day there are cures being worked on, there's treatments being worked on, there's a vaccine being worked on. How much of that gets into the counseling that you do for everybody that you come in contact with? And we can start with you, Maureen. We can start with you. I'm sorry, Denise.
I thought Maureen would be better to
Okay,
answer this.
you can go to Maureen. Go, Maureen.
You're talking more about when you're counseling folks, so.
Yeah, just that the whole idea of hope. Hope springs
Yeah, well,
eternal, and hope for a cure, and hope for treatments, and that this isn't going to go on forever.
Right. We are sending out newsletter. That's one thing I didn't mention earlier, called Hopefully Helpful. And we're trying to put in some really good articles for folks, and as well as inspirational quotes and things like that, just to keep people uplifted and things, and give them tips for things that they can do to keep their morale up. So that's what we're doing from the Hope Floats point of view. But I'm not counseling one-on-one with folks like Maureen is, so I'm sure you have a different take on that. But we're just trying to keep our community connected is I think the best thing we can do right now.
Agreed.
I totally agree with that. I love poetry, and I love quotes. I have tons of them on my computer. One of the big ones for now is from Maya Angelou that says, "Hope and fear cannot occupy the same space. Invite one to stay." So when I'm talking to people, say, "Yep, it's going to get over. We don't know when, so we're going to deal with what we have today. Let's talk about how you're feeling today. Let's talk about how you can get through the next week. What are the issues? What are the challenges? How are we going to do this? Okay, what happened good in your life this week? Give me one thing that happened today that's positive, and it can be the simplest thing, like, yeah, I put on a new pair of pants today. I've been in sweatpants for a week, and today, okay, that's positive, or I always tell them the room I'm in has a window right next to the computer. I go, yep, the daffodils blooming, the tulips are blooming. So we have to have hope. It is going to end. If you look at pandemics in the centuries before, they last a long time, unfortunately, but they all end, and ours is going to end too. And so that's how I help with hope. Just keep planting hope.
Absolutely. I had one more question, Kathy, and it's probably starting with Denise. How do you help children deal with the anxiety? They're concerned that their parents are going to get really sick or die, or their grandparents are in the hospital, or they hear about how the elderly are really at risk. How do you deal with that for kids? Not only for how do you counsel parents to talk to their kids, and how do you counsel the kids themselves?
So this one is a Maureen question.
Okay.
She works with a lot of children, so I'll let you take that.
Okay, Maureen.
But and I'm not passing it off, and I'll come back. But Vedna has young children, and
Yep.
she works on the front lines. Vedna, how are you helping your son?
So actually being truthful, being truthful with him. So in the beginning of this, we had a conversation about what he understands Corona to be. I took some videos that were online that were specifically for children, and we watched the videos and then we talked about it. And so for him, he always talks about until we kill COVID, or he goes this, or they kill the coronavirus. So, and I do check-ins with him. I do check-ins with him every couple of days and ask him, how are you feeling? How are you feeling about not seeing your friends? How are you feeling about not being in a classroom? Can you draw that for me? Just so, there's one thing to say it, there's another thing, to kind of, they're very, obviously expressive with their, with drawings. Can you draw that for me? It's funny, the other day, we were doing the schoolwork and my son goes to me, "Oh, it's like you have two jobs. You're a nurse." He was like, he said, "You're a nurse and you're a coronavirus teacher." I said,
There you go.
yeah. So I think being truthful, and given their age, because given their age and how they kind of process information. But my son, he's 7 years old, and so I'm more truthful. I'm truthful with him, which is in an age appropriate manner, and just letting him know that there are people out there that are helping to fight this, and that this will be over.
Yeah. I do have one more question. Sorry, they just keep coming in.
Sure, no, I'm glad.
The whole idea of how people's personalities are changing a little bit, and how, whereas maybe mom used to, nothing would bother mom, and now she's uptight all the time, or dad has changed a little bit, or you can notice your coworkers aren't acting the same as they used to. How do we all acknowledge it and respond to it appropriately and help people get through it? I don't know who wants to start with this one. Vedna?
I had a situation, it was early on in the during the crisis, and so it was a coworker of mine, and we were doing care on a patient that had passed, and so for her, she became upset, and she actually was apologetic about being upset, and so for me, it was validating her emotional response to something that something that was normal. So I said to her, don't be sorry for crying about your patient. I said that is a normal response to this. So I think it's just validating responses. That's fine.
That's a great word. Who else wants to weigh in on that?
I think I have a big kid at home, my husband, so I don't have any little kids. But I think that validating is huge, what Vedna said. That's very huge. And I find that some days he's having a bad day and I'm having a better day. And I think just giving each other the space to either have time alone or to come together and knowing that I can talk to him about how I'm feeling is so important. Or if I say, I just need a little time, I'm going to go take a walk and be by myself, that we're very in tune to how we're feeling and what we need at that moment. So I think it's just really important to give each other the space to either be there for them or let them have time alone.
Yeah. And Maureen, do you want to weigh in on this too?
I will. There's a line from Mr. Rogers that says, if something is mentionable, it's manageable. And I think that is really important now in COVID. I think we need to, as Denise and Vedna have said, we need to validate how we're feeling.
Yeah.
And we have to mention it. Yeah, I'm scared to death of my daughter on the front lines. Every single day I'm scared. But I say it to Phil, I say it to Katie, I say it to my son. And we're managing it, and that's how I deal with kids too, and with parents. Yep, your personality is going to change a little bit because we're scared. We're all scared, but let's talk about that, and let's go from there. Let's support each other. Let's care for each other. That's what's really important. Even though it's virtual hugs, and even though it's virtual therapy, we are still all together in this. And we're so lucky that we've got the internet. I can't imagine doing this 50 years ago
Absolutely.
before internet. I really
Yeah.
can't even imagine what that would be like. So
Yeah.
we've got that, and I'm very grateful.
And you all, it's validating is so important, and you've all mentioned that. The other thing is that comes to forth is people do not have time for themselves anymore.
That's true.
You used to have the little patterns of, oh, I get home at 5 and my husband gets home at 6 and the kids are off, and that's all thrown up in the air. So your time that maybe you didn't do anything, or maybe you just watched a soap opera for 30 minutes or read a book or took a bath or whatever it is that you like to do by yourself and alone, your alone time, that has gone out the window. How do we deal with that? Because that is also a loss. Vedna? I love how you raise your hand.
I'm raising my hand. I asked for it. I think in the beginning, you're doing this, you're trying to find this new routine in your home. So my husband and I, the days that I am off, he is working. And so we're both doing the the homeschooling at home with our sons. So we ask each other for it. So I will say, can I just have a moment, an hour or so, 2 hours or so to be alone, no interruptions. And then he will say likewise. So just to if there's an ability to do so, and if you have that relationship with those people in your home, to ask for it.
Great advice. Anyone else want to weigh in on that alone time?
I suggest to my parents of young kids, it doesn't work with toddlers, but to create a quiet hour.
Oh.
And so for one whole hour or a half hour, if you have kids that can't do an hour, no one gets to talk. They can use their tablets if they have headphones on. No TV is on. Preferably is books or clay or Legos, but they can do whatever they want for 1 half hour or an hour. And that's your time to go into the other room and with a glass of wine or a cup of tea or headphones yourself. And for 1 half hour or an hour, you have a quiet time every day.
That's great advice. That's great. Denise?
Yeah, I ask for it because I'm a person that sometimes need that alone time, and my husband's always around now, so we're both working at home. But again, we're just very open and honest about what we need, and I ask for it. Even today, I said, I need you to be out of the house. I'm doing this today. And he's fine, good. I'll go do something. I'll take a ride or something. So we're, if you have to just be honest and give each other that space, like I was saying.
Yeah, absolutely. And Kathy, now to you. Kathy LaNatra, you're a mom, you're a wife, you're a state rep. You are getting phone calls from 6 a.m. to midnight and all different subjects. Yeah. Kathy, help me with this. Kathy, can you do this? Where do I go for this? How does this work for you? How does this work in your life?
I was giggling to myself when they all said I asked for it. I'm like, oh God, that sounds so simple. I should probably just ask for it, but I haven't. I made an investment before this all started in a Peloton, and it is in my basement, and that's the first thing I do when I get up, and that sets the tone for my day. If I feel that I'm sitting for more, that I try not to sit for more than 4 hours. If I do, I go for a walk around the block. Or I've taken up running again. I used to run many, many years ago, and I started that again because nobody wants to run with me. So that's alone time for me. But it's, I think I've mentioned it before. I have this plaque that says, you may call it chaos, we call it family. So my family runs around controlled chaos is what I put it. It's not total chaos, but it's controlled chaos. So we've always been that way. I have 4 children. 2 have grown and left, but I have a 13 and 14-year-old home with pets and a husband who works quite a bit. So, it works. After this, though, I'm thinking that I may need a weekend alone.
Yeah, at least.
I'm thinking Mirbeau and Plymouth. I'm starting to save my pennies now.
Yeah, and I just wanted to point out to everyone who's watching that on your website, Kathy, it's LaNatra.com. You do put under your COVID-19, if we can pull this up, our COVID-19 section, you list tons of resources, and everyone that you've brought on for the past 3 weeks is listed on here. And that's just a great place to go for all the, thank you, all the resources that you bring on, all the people that you bring on, because the information that we're getting on a daily basis is really, really, really helpful. And I just want people to know that that's where they can go to get updates on everybody who comes on to your programs, which I think are magnificent. And those are all the questions I had for right now.
The resources available, I don't think so many. So it's so great that we can do this and connect people to the resources that they need and some advice that you wouldn't even think of. So this has been so helpful to so many that I hear after each show. I get feedback from my constituents, and they really find all this information very valuable. And I honestly learn something each time, and I appreciate that. And I do want to just mention, I'm so grateful to the three of you for all that you do. And I know that it's not going to be easy for any of you when this is over. So it's so appreciated. And I'm so grateful, as well as many others around. And I wanted to thank you so much for being part of this show today.
You're welcome.
Thank you.
For inviting us.
Thank
If
you.
you had to give one piece of advice, each of you, as a parting thought to the people that are watching, what would that be? And let's start with Denise from Hope Floats.
I would say if you need support, seek it out. You can email us, or I am checking voicemail. Get the support, because sometimes we feel like we can power through this, but you can't always do that. And it's nice to have connections with other people who have had similar losses or similar situations, like our group that we're doing for nurses in a couple of weeks. Seek it out, because it's there, it's available, and for us at Hope Floats, it's completely free. So we want you to be able to take good care of yourself. So seek it out.
Thank you. And the Hope Floats, if you go to the website, there's just so much. You have so many programs. I'm just like, wow. I can't believe all the things that you have there. And trying to run them remotely right now must be really difficult.
I know, it's interesting.
Well, good for you for keeping at it, because it's a wonderful resource. And let's go to Vedna. What would you give as parting words?
I'm gonna piggyback on what Denise says. Is actually, if you do need to speak to someone, just to seek assistance, to open up, I would say, not to kind of keep things bottled in, whether that be professional, family, friends, to take time for yourself. I think sometimes we get so wrapped up. It's so interesting that in the beginning of this pandemic, it was a time to kind of slow ourselves down. And then we found a way to come back up in terms of figuring out a new routine for ourselves. And I find that some people have become busier even amongst this pandemic. And so just finding time for yourselves and actually speaking to others when you kind of feel like bogged down or anxious.
And that's really good advice. And Maureen, takeaways for people today?
Obviously, I ditto the two things that Denise and Vedna said, but I guess I would say to be kind to yourself and to be kind to the others in your life, to hold on to hope and look for joy every day in the tiniest things.
Wonderful. That's wonderful. And Kathy, let's bring it back to you and talk about
Wow.
more to come from you, which is wonderful.
Yes, this has been a great 45 minutes or 50 minutes with all of you. I've taken some great takeaways. Next week, we're going to continue this. And next week, we're going to talk about anxiety, specifically for the small business owner, what they're going through. I'm looking forward to that, and I'll announce our guests in the next coming days. But I look forward to sharing this time with you as well, Julie. This has been great, and I appreciate everything PAC-TV does to keep everyone informed in our community. And thank you. Thank you to our guests.
And your guests are wonderful. Every week they've been wonderful. And having this just really talk about your mental health during the pandemic, just honing in on that one subject has really, I think, been incredibly valuable, because there's so many subjects you can go off into. And for people to know that this 45 minutes or an hour is going to be dedicated to this subject is, I think it's a blessing. And like you, Kathy, I've had so many takeaways from the people you've had just so far in the 3 sessions that you've had here. So thank you so much for organizing this and for putting this whole thing together. This was your idea, and it was wonderful.
My pleasure. My pleasure. I'm just, our physical health is talked about so much, and I think that sometimes we still have the stigma attached to mental health, and people are afraid to reach out. And I think once we bring these panelists on and they speak, it makes it less inhibiting, I guess, or it makes it easier for them to reach out. And we've discussed before we actually started that back in the 80s when we had a recession, it was never addressed, and the after effect of that was not pleasant. So we're hoping that people will get the tools that they need to get through this pandemic, and they'll be kind to themselves and be kind to others. And hopefully this will make a big difference to some people.
And I'm sure it will, not only now, but down the road. And you allow people to speak. You allow people to be honest with themselves and with each other. And nothing should be thrown under the table. This is what we feel. So if you feel it, it's real. So we shouldn't be afraid to talk about it. Thank you, guests, so much. You were wonderful, all 3 of you.
Thank you.
Kathy, thank you. We date stamp every time we do one of these shows because everything changes week to week, and hopefully there's a week where we'll have somebody on and you'll be open and we can go give you a hug, and we're looking forward to that. So if you want to see this replayed, go to PAC-TV.org/regional for any of our regional forums, and we do consider this regional information because it's good for everybody. Thank you, Kathy LaNatra, and thank you from PAC-TV, and we will see you next Friday at 1:30. This is Julie Thompson. Have a good day.